Welcome to another edition of CCH Checkup brought to you by Carroll Community Hospital. January is Cervical Health Month, so today we have joining us Tami Dutcher. Tami is a nurse practitioner employed by Carroll Community Hospital, and she'll be talking to us today about cervical cancer. Thank you for joining us, Tami.
Thank you for having me.
Let's just jump right in. Tell us a little bit about cervical cancer.
Cervical Health Month provides the opportunity to raise awareness about how women can protect themselves against cervical cancer and HPV, which is the human papillomavirus. According to National Cancer Institute, more than 12,000 women will be diagnosed with cervical cancer this year. HPV is a major cause of cervical cancer and is the most common sexually transmitted disease. Approximately 79 million people in the United States have HPV at any one time.
How many different forms of HPV are there?
There are many forms of HPV. Most people with the virus have no symptoms, and their body clears the virus without any issues. With other forms of the virus, some people get genital warts or cancer. Cervical cancer is preventable by getting regular Pap tests.
Tell us a little more about that. What are Pap tests?
Pap tests detect abnormal cell changes before cancer has a chance to develop. Most women diagnosed with cervical cancer either have never had a Pap test or did not have one consistently. Cervical cancer takes years to develop, which is why getting Pap tests routinely is so important. There is also a test for women for the high-risk types of HPV that cause cancer. The HPV test is completed at the same time as the Pap test and is generally done for women between the ages of 30 and 65. Women should start getting routine Pap tests at least by the age of 21.
So are there any ways to prevent getting HPV?
HPV and cervical cancer can also be prevented by getting the HPV vaccine, which is given in 3 doses. The vaccine does not prevent all types of HPV, so Pap testing still needs to be done. The vaccine is recommended for males and females starting at the age of 11. If someone hasn't gotten the vaccine yet, they are still able to get it until the age of 26.
So is there any test for males to check for HPV?
Currently, at this time, there is no testing for males.
And how much would the testing cost for females?
Generally, most insurances cover the testing, so I would advise people to check with their insurance to make sure that it's covered. Or if someone does not have insurance, there are certain programs that help women get testing done for free. They could check through the health department or with their provider.
Okay, we've been joined by Tami Dutcher, nurse practitioner, talking about cervical cancer today. Thank you very much for joining us, Tami.
Thank you so much for having me.
Join us for another edition next time of CCH Checkup brought to you by Carroll Community Hospital. And as always, visit cch-mi.org for more information.